Good morning. Good morning. It's Saturday morning, but we are still here for Focus on It Friday, the bonus Saturday edition. Who's here with me? Come on, come on, come on in the room on a Saturday. Mama's watching. Hey, Mama. Frida's watching. Hey, Frida. Good morning. Y'all are up with Dr. Brandy B super early on a Saturday. Hi, Andrea, all the way from Lamar County, and Frida's from down South Alabama. She's a LA girl in Lower Alabama. We've got Dejournay. Thank you this morning. Hello, Priscilla's watching. We're glad you found us, Priscilla. We missed you yesterday, girl. So I had to do something so you could catch up with us. Hello, Auntie Roslyn. Hello, Judge Stevens. Thank you for joining us this morning. Lowndes County. That's right, Lowndes County, down in Lower Alabama. Hi, Nikki from Georgia, bringing in our Eastern time zone. And let's see who else we have. I'm sorry I was a few minutes late. I had to get my co-host situated. Y'all know that they like to participate in the show, but they were not used to a Saturday morning, and so we had to get them situated. So I was a few minutes late coming on. Good morning, Miss Sadie. Good morning, Alicia. I'm glad you made it. I don't know why it wouldn't let me tag you this morning. It did that for some. Auntie Rosa says, I'm here. Good morning, and you're looking mighty pretty today. Thank you so much. I had to switch up my hair a little bit for y'all on a Saturday morning, but I am here and I am excited. Hello, Miss Luella. Hello, Melissa. Good morning. Thank you all for watching. We had so much fun yesterday. I got carried away and I said, oh my goodness, I don't know if I really told them everything I want to tell them. So you know how we are over here at Dr. Brandy B. We like to be thorough and complete. And so here I am today on a Saturday morning with my co-host in the background. Hopefully they will be quiet. And I'm just going to tell you all about what more you can expect at the first visit with the psychiatrist. My hair is super cute. Thank you, girl. Andrea, thank you. Good morning, Jeremy and Dia. Good morning. Hello, Auntie Louise. Let's see. We'll give people a few more minutes, and then we're going to let you all get to your day. I'm not going to keep you long today. So if I start going long, more than 20 minutes, just say, Dr. Brandy, we got stuff to do. It is Saturday morning. It is not Friday. All right. Good morning, Dr. Brandy B says, Miss Sadie. So good morning, good morning, good morning. Let me go ahead. I'm watching you on my big screen. Oh, girl, how do you do that? I need to get those types of tips because I don't know how to do it. Looking pretty this morning, says Priscilla. Why, thank you, thank you, thank you. Miss Joyce is joining us. Thank you. Y'all are so kind to a little old girl from Birmingham over in the West End area. Y'all are so kind to me. Well, let's go ahead and get started. I am Dr. Brandy B, your triple boarded child and adolescent psychiatrist. Through my Facebook Lives, my seminars, my presentations, my books, and everything else that I do, I help worried, overworked, overwhelmed moms of children with ADHD and other mental health issues get the education that they need as moms so that they can help their kids be empowered, be engaged, be successful in the classroom and in life. She says, Nicole, just cast it to your TV, girl. Is that English? Cast it to my TV. We're going to have to see about that. I am too on the big screen. Y'all mean that is your color. Thank you, says Melissa. Listen, y'all. Olympia, thank you for watching. Miss Young, thank you for watching. We've been missing you, Miss Young. Look, y'all, go ahead and take pictures of me on the big screen. That is just to forecast what is to come. I love it. Send me a picture. Text me those pictures over where I'm on your big screens. I love it. I love it. I love it. Well, let's go ahead and get started because I'm not going to keep you 20 minutes. That's my goal. Now, yesterday we talked about, am I going to get a shot? Because a lot of times kids are nervous about coming to see me. And I have to remind them that in my role as a child and adolescent psychiatrist, I do not give shots. But what I do is talk a lot. I talk a lot, okay? But more importantly, as a psychiatrist, I listen, okay? So that's one of the things you want to make sure that your person can do is that they are listening. But let me just review because we have some new people coming on today like Mylene. Good morning. Maylin, I'm sorry. Good morning, beautiful. Oh, thank you. Y'all are just so kind to a girl. Y'all are just so kind. Let's review what we talked about yesterday. Congratulations. Number one was congratulations on making the huge step to say, I need to get some mental health treatment. Huge step for you or your child. Huge. Number two was we defined some things, right? So a psychiatrist, like me, is a medical doctor. I have an MD, and then there are psychologists, and they get the gist of medicine, but they can't prescribe them. They either have a PhD or a Psych D. Then you have nurse practitioners who are mastered level nurses. Okay, and they get a certified registered nurse practitioner. They can prescribe, but they have to be under the direction or kind of the watch, if you will, although a great deal of them can practice independently of, making the decisions as a physician would, but they have to, at least in the state of Alabama and many other states in the country, work under or collaborate with a medical doctor. And then we have therapists, social workers, and counselors. And social workers have a social work background, whereas therapists and counselors have gone to school, most of them, for counseling. At the end, though, everybody needs to have some certifications that they pass that say that they are equipped to be able to do the job. And then you have your life coaches and mentors, and they can be very good at what they do. Their training and certifications may vary, and you're not going to find them on the National Board of Medical Examiners, for example, like you do with my profession. All right, and then number 3, so number 1 is congratulations on making the decision. Number 2 is know who you're going to see, what their credentials are. That may or may not matter to you, but if you're seeking medications, it should, because everybody can't do that. And if you don't want medicines, remember that you may not need to see for example, a psychiatrist. That may not be the best person for you to see, because that is a great deal of what we do. Number 3, know what you're expecting, and that speaks to what I just talked about. If you want medicines, that's fine. If you don't, that's fine too. Just know what the purpose of the meeting is and what you want out of it. Number 4, ask around to make sure that that person is someone that may be compatible with you. Someone who only wants to push medicines and doesn't want to talk to you. When you walk in, they have the script ready and they're like, hello, here's your script, goodbye. That may not be a good person for you. What you see over here at Dr. Brandy B is what I give you every time. Now, I'm going to warn you, there's not a whole lot of people out there like me. And I mean, that's not being ugly. I'm just kind of one of a kind. I like the education piece. I think it's because both my grandmothers were teachers, several other family members were teachers, and until 10th grade, I actually wanted to be a teacher and still have some desire to teach. So if there are any educators out there and you want to collaborate with me, just have me like one day a month to come and teach some science or something, whatever. I like teaching. I really like educating people, because education is the basis for everything else that we'll do in life. So you need to know if that person is compatible with you as far as the way that they approach you, what we call in medicine the bedside manner and all that sort of thing. Now, I understand that because of insurance and money and whatever else, sometimes you get what you have to go to, and that's really unfortunate. But bedside manner really can't be taught. That's something that you were born with. All right, number 5, once you have a psychiatrist in mind, contact their office, and we talked about how to contact them. If you need more details about any of these, please go check out the Focus on It Friday from yesterday. It was really good, and we spent a lot of time on these. Complete all your paperwork. Nothing moves until you complete your paperwork in a lot of practices. Some practices will allow you to bring it with, and some practices will... Oh, Andrea's already sending me my message, I imagine, of me on the big screen. Some places will allow you to bring your paperwork with. Some places will schedule an appointment, but not, and you will allow you to send in the paperwork. And then some practices like mine will not even give you an appointment until your paperwork is in. And so you need to know that. It's okay to ask, how far down am I on the wait list? How long is the wait list? These are all good questions. And a good staff is going to be willing and excited about answering that for you. And you should, when you're going to any specialist, psychiatrist included, be prepared to wait at least 2 months, but depending upon where you're going, a year, unfortunately, okay? Figure out what the associated fees are is number 7. Figure out what you're responsible for. Figure out what your deductibles are. Figure out what your copays are. That is your responsibility. So if you go to a doctor's office not fully understanding if that doctor is one that is recommended or covered by your insurance, those bills are going to be on you. And so you want to know that going in so that you don't get any surprises a month or 2 later. Number 8, be prepared for virtual visits. In other words, accept that that is probably how you're going to meet with the provider, because in today's society, in today's climate with the world and coronavirus, and now they're saying it's going up, and people are just kind of they're just kind of careful, and I don't think that has anything to do with your amount of fear. You know, I look both ways before I cross the street. That's not because I'm fearful of getting hurt. That's because I have good common sense. And so I'm not going to step out into oncoming traffic without looking to make sure. So that is your being prepared for virtual visits, because most people are doing them now. Number 9, be prepared for the visit in general. If you know that you have a certain set of questions, don't be afraid to ask them. For example, with me as a child psychiatrist, the majority of what I see are children who have ADHD. I know what the concerns are of people, of parents, as far as treating their children with psychostimulants or stimulant medications. They wonder if their kid is going to grow and be a normal height. They wonder if their kid is going to have genitalia that is the appropriate size when they grow up. And then they wonder if their kids are going to be on drugs. I've heard these questions enough over my years, and so I just go ahead and address them oftentimes, especially if I can tell that a family is really kind of on the fence. Some families come in and they walk in and they're like, hey, just give us the stuff. We are 10 years into this. We know. Other families just need more attention, and so I give it to them. But if you have questions already addressed, that really, really, really helps, because like I said yesterday, once you leave, you are gone until the next visit, and then I'm still going to take care of you, but you won't get my undivided attention because I'm having to give it to someone else. All right. And number 10, be confident in your decision to get yourself or your child treated. Make sure that you are not listening to none of them, mama and them, grandma and them, any of them. If they're a preacher and they don't believe in that, well, that, you got to work with that. But make sure that once you make the decision and you really feel that that is what's best for you and your child, that you're confident in that decision and that you can move forward and help everybody get better. So that's the summary of where we are yesterday. Let me come speak to some people. I don't want to be rude, have people at my house, then I don't speak to them. Hi, Miss Rachel Hilburn. Thank you for watching. Hi, Miss Destiny. Thank you for watching. Miss Amber, Miss Chantrice, Miss Jonique, Miss Melanie, Miss Danita. Oh, I see those eyes, says Priscilla. Yes, girl. Got me a little something, something. And Miss Lucinda Turner. Thank y'all for watching. All right, so if you need to hear more about any of that stuff, hello, Miss Burnett McGinnis. Thank you for joining us. If you need any more information about any of those things that I just talked about, then please go ahead and listen to the presentation from yesterday. It was super good. I mean, I went into some stuff that probably stepped on some people's toes, but that's what we like to do over here at Focus on It Friday. Thank you, Nikki, for texting me that picture of the big screen. I'm sure I'm excited to see it. We want you to be educated, and I want to be truthful with you about what's going on. All right, so now moving on to today. So that was a lot of what happens to, oh, y'all are showing me some love. Thank you. I love y'all so much. Most of what we talked about yesterday was what happens prior to your appointment. And so it came to me this morning. I didn't tell the people what actually happens during the appointment. And so I want to be thorough, and I want to make sure that you understand, because you may be on the fence and you just don't know what's going to happen when you actually make it to that appointment. So here is what we are going to talk about today. What happens? And I'm looking at my notes, of course, so I can stay on track. I've got probably 10 or 15 minutes. I'm going to let y'all go, I promise. When you get there, of course, we're going to ask the child's birthday. You're going to check in. And so some of this is going to be a mix of coming to a real office, a brick and mortar, and some of this is just going to be a virtual type of visit. But somebody's going to check you in. There's going to be some check-in process where we're going to make sure you're there. And yes, even if it's a virtual appointment, and I don't care how young the patient is and how much they do or don't talk, they have to be there. The child has to be there. Whoever the patient is has to be at the appointment. So if you go to work and send the child to school or leave the baby with grandmama and them, then that is not an appointment. But we're flexible. And so if you can figure out a way to get grandmama to answer her phone and show us the baby, and you do that, we can do that. But the baby, the child, the adolescent has to be a part of the meeting. So you're going to have a check-in process. In that check-in process, we're going to make sure that we know who you are. What's the child's date of birth? Do we have the child's name spelled correctly? Are there any copays? Okay, some doctor's offices will not even make an appointment until that copay is made. So it just depends, but there's going to be some sort of check-in process. The first thing we're going to do is what is called in medicine a chief complaint or a chief problem. And that is going to be why you're coming in. I typically will say something like, what brings you in today? And for people that start going on and on, because I only need like one sentence. My child's ADHD. She won't sit still, whatever the case may be. That is called a chief complaint. All right. That's just what it's called. Chief concern, chief problem, whatever it is. That is what is happening. Andrea says, I'm glad you addressed this. Yes, ma'am, we have to address this. Andrea works with me, and so she knows. Miss Sand and Troy, hello, thanks for joining. And Miss Armand Matthews, thank you for joining as well. Thank you for joining. And remember, if you missed the beginning of what happens prior to the appointment, please go check it out over on my fan page where you are now and learn more about what leads to the appointment and how you actually go about getting one the right way. All right. So that's called your chief complaint, your history of presenting illness. That is the point where we talk more extensively about what you told us was your chief complaint. And just as an aside, all of medicine works like this. Every single doctor that you go to for the first time, they're going to be following this same format. So when you say, well, what brings you in today? And I don't know. That's probably not helpful. Neither is my therapist just told me to come. That's not helpful either. You are coming in to have some problem addressed. That's what we want you to know. That's what we want you to tell us. So then your HPI or history of presenting illness is more about that. So if you say, I came in because my child is sad, okay, great. I'm going to ask you now all the questions that are related to sadness. When did it start? How long has it been going on? When is it worse? What makes it better? How long has it been going on? Are they sleeping? Are they eating? Have they lost weight? Are they irritable? Are they talking about suicide? These are all the things that I'm going to ask you. And so it's question after question after question after question. And sometimes people will say, well, didn't you read the note? I've already told so-and-so this. And I remind them that it's kind of like dating. It doesn't really matter who you've dated in the past or for how long you've dated them. If you're meeting up with somebody else, you don't refer them back to that person to get your history and who you are. You tell that new person. And that's the same with me. Yeah, I've read it. Yeah, I talk to them, but now I want to hear it from you because you know what happens a lot of times? I get stuff that other people don't get. And it's not because I'm doing anything special. It's just because people tell doctors more, and I recognize that. So we're going to ask you all sorts of questions, and we're going to do that for every single disorder. Not only am I going to ask you about sadness, I'm going to ask you questions about anxiety. I'm going to ask you questions about ADHD. I'm going to ask you questions depending upon what the child looks like when I see them, which is why I need to see them. I'm going to ask you questions about autism. All right. So all of that goes into, for the most part, that history of presenting illness. Okay. The next thing I'm going to go into is a review of systems where I may ask you about, you may have already told me about, or I can look at you and tell about every system in your body, from your head to your toes. I was about to start going into medical jargon. But your eyes, your mouth, your nose, your ears. So we call that HEENT for its head, ears, eyes, nose, and throat. Okay. So literally, I note if your nose is running or if you have a cough. That's all a part of your review of systems. I want to know about your breathing, chest pain, and all those things, all the way down to your joints. Okay. So your doctor, your psychiatrist may not necessarily ask about all of that, but we're noting it, okay? And sometimes it just comes up with, in casual conversation. So just know that anytime you step into the office or onto the camera, there's Faith, guys. Tell her hi. All right. It is going to be something that's noted as part of your interview. Faith is the 20-month-old, so the door is locked, so don't you worry. All right. Your past psych history, okay, that is where we're going to talk about medications you've had tried in the past. That's going to be where we talk about hospitalizations, psychiatric hospitalizations, any therapy that you've been in, anything that's related to mental health treatment that happened before the date that you're seeing me. That's what we're going to talk about there. Your past medical history. For young children, that's going to be everything pertaining to how old was mom when she was pregnant? Was her pregnancy typical? Were there any complications? Did she use any drugs or have any other environmental toxins? All of that is a part of the child's birth history. Then I'm going to want to know about development. Did they meet milestones on time? And people that hang out with me on Dr. Brandy B, you know that crawling is not a milestone. Some people will say, oh my goodness, my child didn't even crawl. Genius status. And we know over here at Dr. Brandy B that that's not a developmental milestone. So some kids will skip it as such. All right. All of that is a part of your past medical history, okay? So your past psychiatric history and your past medical history are different. How was the pregnancy? Was it term? And anything term is 37 weeks or greater, all right? So if you said, no, she came a week early, first thing I want to know is, did she come at 36 weeks or did she come at 39 weeks? But 37 weeks is considered term. I'm going to ask you about substances, and I don't judge you if you use substances and you're not using them anymore. That's great. But I happen to know that if you use alcohol while you were pregnant, or if you use cigarettes while you were pregnant, then those things set your child up to have some other issues. If you use cocaine or methamphetamine when you were pregnant, that was in your history. And so anything that was in your history, I'm not calling DHR about necessarily, but if you told me you were smoking something with them yesterday while they watched, that may be more concerning. So everything I ask has a reason, and this is why I wanted to explain this. All right. In the past medical history is going to be disorders or diagnoses that they have, as well as surgeries or other medical hospitalizations. Let's speak to some people just to make sure everybody. Hi, Carl Jones. Hi, Angela. That's my sis, y'all. Hey, sis. She says, hello, Mr. Classic Eppinger, Miss Marilyn Jackson. Thank you for watching. Andrea says, Faith is a doll. She is a doll, but she's got all kind of dolls within her. That was the Let Me In doll that y'all just heard. Miss Levy Banks, thank you for watching. Auntie Rosin says, hi, Faith. Hi, Lenard. Thank you for watching. Angie says, hey, TT girl. She probably was telling you, hey, she must have known. That's why she kept banging. And Miss Levy Banks says, hi, Brandy. All right, so moving on, we got the chief complaint, the history of presenting illness, the review of systems, the past psych history, the past medical history, all right? And that's going to be very inclusive. And yes, you've sent it on the paperwork, but sometimes parents forget or they leave something out, right? Because what are they trying to do? It's a mad race. Let me just get something on this paper and send it off. So when I ask them about, these questions, they may tell me, oh, I left off that, she had a knee replacement. Well, that might be pertinent, especially if after her knee replacement, she was no longer able to play sports. And then that's when her depression started. That's a key piece of the medical history that now is impacting our history of present illness or presenting illness, and also our chief complaint, right? She got depressed after she had a knee replacement and can't play sports anymore. All right. Let's see what else we got now. Current medications and allergies. Please know them. And really, you ought to have those bottles with you at the appointment. You're at your house. Just when it's time for your appointment, go get all those bottles, bring them in so we'll know. Because sometimes what happens is between meetings, there may have been some adjustments. And so my note from that place from our last visit and what's happened in between are in two different places. And so most people aren't having changes between meetings, but if they are, I need you to know, whoa, we're not doing that anymore. We're doing this. So that's the best way to help me help you. And you should always be able to spit out your medicines and your child's and what they're for. And any good doctor with some good bedside manners ought to be willing to tell you exactly what it's for. I go out of my way to make sure that my patients know what they're taking, what it's for, how to take it, and I'll even spell it if I can sense that they are writing it down, because that's perfectly fine. Listen, when you go to buy a car, go to Belt to get a dress, whatever, you're looking at stuff, you're asking questions, you know about certain designers. You should take your health care the same way. One of my colleagues actually, and when she gets everything ready, Dr. Kelly actually has a book that helps you keep all that stuff together. Because here's the deal, we're all gonna die. And if nobody knows any, or we may just go to the hospital and you may be in a position that you're out of town at the hospital. Nobody knows your health care. They don't know what you're taking. They don't know what your allergies are. So we really need to make sure that we are doing a better job at keeping up with those things. So I went off on a tangent. I'm going to try to stay focused because y'all know I get excited. So that's your past, your current medications and allergies. Your allergies are very important. Please, right here on a note about allergies, know the difference between an allergy and a side effect. An allergy means, please don't give this to me because I could die. A side effect means, oh, okay, you had a little diarrhea after your antibiotics were given. We will try not to use that antibiotic again. But in the case that we find ourselves in a position where we absolutely have to, stay close to the bathroom so you can get better. All right, it just kind of comes down to that. But once something gets put on your record as an allergy, those are big words, and sometimes it can make your treatment very difficult. So make sure you know the difference between an allergy and a side effect. And in my world, make sure you know the difference between the medicine didn't work and we didn't get up to an adequate dose of the medicine. Those are two different things, because it may come a time that we're right back around to, nothing, and the medicine that you said didn't work. And if you tell me, well, we only took 10 milligrams of it, in my mind, we don't know if it worked or not. Okay. How do we know what I like giving you all analogies and things that you could compare it to. If you as an adult take 10 milligrams of Tylenol, acetaminophen, until they put me on their payroll, acetaminophen, if you take 10 milligrams of acetaminophen for your headache and you say that acetaminophen didn't work, first thing I'm going to say is, well, you probably are taking much, much, much too little. Y'all catch that? See how that's different? Type I see how it's different if y'all are still with me and you see how that's different. All right, going on. That's your allergies. Family medical history. All right. Let me go back. Says, Troy had my phone. It's me now. Girl, he told me it was him. But welcome, welcome, welcome. Keisha Bias, thanks for joining. We got some new faces. Auntie Ross says it's very important to know your medications. It's very important to know. Mama Rudolph says it's always good. Amber says it's different. Dia says it's very different. Thank you, Dia, for watching. And Mr. Jeremy over there. Oh, that sounds like Franklin is crying. They're going to be strong. They know I'm talking to my friends around the world. Don't call the people on me. They're okay. They have food, TV, and phones. They're good for the next 15 minutes. Okay. All right. Y'all hanging in there? What else we got? Family medical history. Now, I'm not trying to be all in your business, but your family history is important. And let me tell you why. There are some things that run in families. There are some things that are genetic. There are some things that are hereditary, and all those words kind of sound alike, but they're different depending upon, is it truly caused by a gene, or do we just see it in families, but there's no true genetic link? Like there's not one gene that's causing it, okay? And so I just need to know. So for example, with ADHD, we know that more than 50% of dads of children with ADHD had it, and we know that more than 30% of moms had it. So that's very good for me to know. That falls under family. And so some people will lump it all together, family medical versus family psychiatric. Either way, it's part of the family history. The mental health disorders. I don't really care who in your family was on drugs, but I need to know that. I especially need to know if you as a parent have a history, because some of my medicines, we need to talk a little bit more about how far you are into your period of sobriety. If your last use was yesterday, but you're trying to work on it, I need to know that. I need to know that. If you've been clean for 8-10 years and it's the farthest thing from your mind, that's good information for me to know as well. Bipolar disorder, Anxiety, y'all, just in case you were wondering, is the most common mental health disorder in all of the world, okay? And so if there's a strong family history of anxiety, I need to know that, because I need to be watching out for that in your kid. So I'm not trying to be in your business, but I do need to know. Don't be embarrassed. I promise you, whatever you're about to tell me, I have heard 10 times worse. Believe me. Yours is nothing. And I type what you say, I register it, and I keep on going. Saw a child not long ago. The dad died suddenly at 35. So in my mind, was he on drugs? Did he have a car wreck? Something else going on? He had a rare heart condition that no one knew about. Guess what? The medicines that I prescribe on a regular basis can affect your heart. So immediately I knew that before I did that, I need to get more tests on her. So your family history is very important, and you should make sure that everything matters. Everything matters. Okay? Tell me more about your family history than you're telling me about your baby daddy and what he did outside of the home. Unless that is impacting the child, I really need to know more about your family history, because that's really important to what we're doing with the kid. All right? Social history. That's going to include where do you live? Who do you live with? I may even ask, what type of home do you have? And why is that important where you live? And if you live in some sort of housing project or whatever. A lot of times I want kids to go outside and exercise, because remember, I'm a board certified pediatrician too, so I'm concerned about the whole child. And sometimes parents will say it's not safe. Well, okay, no worry. I see, because I'm doing telemedicine, y'all have stairs. Y'all have an upstairs and downstairs unit. Let's hit those steps, all right? We don't have to go outside. Let's hit these steps, all right? Or we're too poor. We can't get a membership at the Y. No problem. You got a large open space. Let's hit that circle. Run around that kitchen into the living room and back. We got to use whatever we can to make it work. And so that's important. I need to know who all is in the house. So I'm not trying to be in your business. I'm just trying to figure out who all is in your house. A mama, a daddy, and a baby sister, an older brother, and then a 23-year-old brother who's home from college. That tells me a lot. These people value education. So then I'm going to ask, well, mom and daddy, how old are you? Okay, now that tells me about some disorders that may be going on. We know that older parents are more likely to have children with certain disorders. Older dads, sometimes more than older moms. So it's very, very, very helpful for me to know, how old are y'all, okay? What do you do for a living? I don't really care. Most of the people that I see have Medicaid, and I love it. Those are my people, all right? So if you don't work, that's fine. If you're working on disability, that's fine too. If dad is a laborer, that's fine. But it also helps me to understand something about the kids learning. If mama says, all I got to was the 8th grade, that may make me explore more about, well, mama, what happened? Well, the work got hard and I couldn't focus. And before long, I dropped out. Okay, and remember what I have told you previous times before over here on Focus on the Friday. Children with ADHD are 33% likely to drop out of high school, and they are also only 5 to 10% likely to graduate college. So mama has already shown me that she fit the bill, and she may even add, I had potential, but I don't know, I couldn't get motivated. Couldn't get motivated is a buzzword for ADHD. All right, I'm giving y'all all kind of stuff. Let me get back on track. Let me speak to some people over here. Let's see who we got. It's different, very different. See how she knows the difference in those babies' cries. Oh, I know the difference. Yes, ma'am. Miss Sadie Gresham says, so true. Not my Frankie. Yes, ma'am, you're Frankie. He was crying. Auntie Roz says, when Pam and I were diagnosed with kidney failure around I think she's going to say same time. Y'all, I don't know why it's not allowing me to click and see the rest of these messages. I don't like that. Oh, there we go. When Pam and I were diagnosed with kidney failure around the same time, we had different doctors, but they talked because this was very important family history. Absolutely. Your family history is so important. Hello, Robbie Cantrell. Thanks for joining. And Miss Bartlett, thanks for joining. Miss Mary Ann Gunter Dollar, thank you for joining. Thank y'all for joining. All right, we're moving on now. That's her social history. So who lives with you? Are your parents married? Are your parents divorced? That's important, right? Because if we just went through a divorce, a lot of times ADHD has typical ages of presentation. All right, the average age of diagnosis is 7, but the symptoms are really, really noticeable about 3. So between 3 to 6, and sometimes on up to 8 is when parents really start to notice it, but 7 is the average age of diagnosis. So we tend to, as humans, link things with certain events. So it may be that mom and dad got divorced when the child was 7. He never had these problems till this year when he turned 7. Well, I'm an astute physician, and I know he's probably had some problems before. So then I say, so he had no problems before that divorce? Well, he always was running around, and wouldn't be still since the moment he knew how to walk. But when that divorce happened and he was 7, and I'm like, I see you, okay. Somebody is showing me a lot of love, but your picture is a lady with a white dress and she's got on black clothes. Tell me who you are. I want to know who you are. I appreciate the love. You're sharing a lot of love with me. And I appreciate that over here at Dr. Brandy B. I am not sweating today, y'all, but it's early and I went ahead and turned the air down. Auntie Patrice says, Roz and Pam, my sisters, absolutely. Hey, Maybeth, thanks for watching. Hey, Auntie Patrice, thank you for watching. Thank y'all for coming on for this impromptu Focus on It Friday, Saturday bonus edition. All right, more in the social history. I'm going to ask you about school. What school do they go to? What grade are they in? Because immediately I know that their age minus 5 equals their grade. So if they're 7, and I take 5, I get 2. So if you tell me kindergarten, I'm going to ask you, have they ever repeated a grade? And you're going to be like, how she know that? It works. Let me tell you, the only reason it does not work is if there is a late birthday. So those late birthdays, September 30th, October 1st, whatever your school has, that will mean that age minus 5 won't work. What's magical about 5? You go to kindergarten at 5, all right? So 10 minus 5 is 5th grade. Is that right? Yeah, 10 minus 5 is 5th grade. 15 minus 5 is 10th grade. 18 minus 5, what's that? 5, 6, 7, 8, 13th grade, give or take. Yeah. I was already in 13th grade at 17. So sometimes it doesn't work. But I'm going to ask you that next question. Have they ever repeated a grade? And most parents don't even catch what I've said, but they were like, no, his birthday was like, oh, okay, great, no problem. Sometimes I'll get a 15-year-old that's in the 8th grade, okay? And they got held back twice. So that's why we ask those sort of questions. I want to know if they're in regular classes, if they have a 504, if they have an IEP, if they're getting some special assistance, if they're getting pulled out, if they do things with the other kids, if they're sitting in the lunchroom with everybody. All of that is important. All of it is important, okay? Because it may come down to that part where they say, well, no, they don't eat lunch with the other kids. Oh, well, tell me why not. It's too loud. Oh, do tell. Tell me more. Well, it's just too much noise in there, and they put their hands over there. Oh, now I'm thinking autism, and I'm going down that track. May not be right, but you don't find many kids who have that situation and that presentation, all right? Hi, Tanji. Thanks for joining. I think you were with us yesterday. Wait a minute. I feel special. What did saying say? Now we got to get this to click. I taught an educator something, y'all, about education. It's not clicking to let me open it. I'm going to see if it'll come on up. I really don't like that my phone isn't doing that. But San, who is big time educator, and thank you for what you do, says, look at you, just taught me something. Just subtract 5, and then all I can see is I. And I'm thinking that she's going to say, I never knew that. But yeah, you subtract 5 from the age and you get the grade, and it works most of the time. All right. More about social history. I want to know about honor roll. I want to know about grades in general. But I especially want to ask the question about honor roll. Why? Because if you say he made honor roll to 3rd grade, ding, 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 ding. For me, as someone who picks up on all the subtleties of, see, you just liked it again. Who are you? Tell me who you are. If I notice that we did fine until 3rd grade, or we did fine until 5th grade, or we're coming in 7th grade with anxiety or depression, that's important to me because I know that those are key grades. Now, I'm no educator. Now, I don't even want to act like it. But those are grades where academics shift, right? And so a lot of times, 3rd grade is that big year where we start with those grades declining. So it sounds like I'm just being nosy, but there really is a method to my madness. A lot of this stuff I've pieced together just from doing it for many years. Sayan says, oh my goodness, I never even noticed. And she's been an educator for probably, 15 or 20 years or so. But it's because I have to She's used to a group of kids all being together anyway. I'm used to all ages flooding throughout the day, and then I start piecing things together. And I need shortcuts, y'all, shortcuts, all right? What else about the social history? I want to know, has DHR been involved? Or if they're involved now? I'm going to ask you, it is important, and let me just go ahead and say this right now. Y'all lean in and listen. I'm going to ask you if you are the child's birth parent. Why is that important? That is important because the family history that you're giving me about you and that child's adoptive dad, it's good information, and it tells me a lot about the environment. This is year 21. Thank you, girl. That's awesome. It tells me a lot about the environment, how sickly y'all could end up being. Do we need to, check on planning for the future? But it tells me nothing about this particular child. And I have polled friends in mommy groups, just my own poll, because it comes up all too often that parents wait too late to tell their kids they're adopted. And then the kids, it's this sticky situation where, do I tell them now? Do I wait till they turn 18? You wait till they turn 18, they may never speak to you again. What I've heard from most people who are adopted is that a child should never not know they are adopted. Now, it's not my place to tell the child, and I'm not going to. But I just want you to know from what we're talking about is the first meeting with the doctor. That history that you're giving me does not pertain to that child, except from a social standpoint. It's not their medical history. It's not their parents' medical history. And that's important to know. But I do want to know about DHR because I need to know what kind of situation were they brought from potentially. What happens from age 0 to age 3 is most pivotal in a child's life. So if you tell it, that is the age where we learn to trust people. We learn to rely on other people to teach us certain things. We rely on other people to change us, to feed us, to do all the things that we need to know how to do in life. And so when we start talking about people are anal, that really does to a great degree have something to do with were they changed as a child. When we learn about kids who are eating poop, peeing in flower pots when there's running water and toilets in the home, they get with foster parents or they even get adopted. And the families are like, we don't understand. Why in the world would this kid not connect with us? It is because no one connected with that kid from 0 to 3. So when DHR steps in at 7 and takes that kid out, it's hard for them to bond, right? So don't take it personally if you adopt a perfectly normal looking, lovable little child and they just don't connect with you when they were left in a closet for days at a time with milk that they had to figure out how to pour on their own. And sometimes, they had poop matted to their bodies. I once had a lady tell me she had to bathe that kid several times for several days before she could get the stench out of the kid. That kid is not going to be able to walk into your home and hug you and love you. Now, there are some kids who do the exact opposite, but there are a lot of kids who are not going to know how to receive that. Some parents will say, I got this kid. He's welcome to anything in my refrigerator. Yet I find wrappers of food under his bed, in his bed, behind the headboard. It's almost like he acts like the food is going to run away. And that is because from 0 to 3, he may not have ever known when food was going to come again. So if the kid went to DHR, but they're back with you, remember, I'm not judging you, but I need to know about that. Because the truth of the matter is that some things may have happened while they were over with that foster family. And we need to talk about that too. But if you act like your life has always been in a picket fenced house, picket fence surrounded house with multiple levels and nothing but love flowed out of the windows and inside the doors, that's not an accurate presentation that you're sharing with me, and that doesn't help me treat your babies. And what y'all remember if you joined me yesterday is what? I want to treat these babies. I want to treat these babies. One more note on DHR. It is not a perfect system, but neither am I perfect or anybody that's watching. But sometimes even your family members, that family member ain't got no business, and I'm going to say ain't got no business, because y'all know I know how to speak the king's language. But that baby has no business being with that mother. But we can't take them, and we don't want anybody else to take them. help that baby, because that baby didn't know any difference. But you can change that baby's life. Somebody needs to help that baby. Okay, I got off key. Let me get back over here. Social history. Who do you live with? What are you doing at school? When did your grades change? Did you get an IEP? I could go on and on about IEPs, special education, that sort of stuff. Please treat those babies. If that baby can't read and he's in the 3rd grade, they're doing something new with reading here. You need to be reading on level by 3rd grade or they're going to retain you. Some people say, well, they need to be retained. I'm not a huge fan, but hey, that's what's about to happen. Okay, so if you know your baby can't read, stop acting. Stop acting like that baby can read. You know that baby can't read. Let's get the baby some help. Auntie Patrice is a retired educator at this point. Thank you for all those years of your service. She's sitting at home like, yep, they could not read, and their mamas did not want them to get any help. Miss Sam Robinson, for a living, y'all, she is taking these babies, the 15-year-old that's still in the 8th grade, and now y'all know what grade the 15-year-old should be in, and she's helping those babies try to get out of school because, right, some of these babies had ADHD. Some of these babies were in foster care. I mean, all kinds of things are going on with our kids. And so we just need to make sure that we're getting them the help that they need and that we're asking questions, right? You are a consumer as a parent. And so you should ask questions at your child's school. You should ask questions at your child's doctor's office. But remember, I think my mama said you get more with sugar than salt. And so you got human beings on the other side. And yeah, they should just do their job. But they're going to put up a wall if you come in there telling them what they're going to do and you rolling your neck. I mean, they might do it, but they might take their time. Hello. All right. Amen, says Auntie Patrice. Hi, Auntie Eva up in Philly. Hey, Miss Yvonne Monroe, she said, so true. All of it's true. That's right. Miss Sam Robinson is crying. Girl, I want to cry every single day. Thank you, Miss Christy Moore. And May Beth says, amen. May Beth is a therapist, so she knows. Hello, my beautiful niece, says Auntie Eva. All right, y'all. What else we doing now? So we've talked about the social piece. So outside of your chief complaint, all these things are big. But that social piece, y'all, okay, Sam says, it's coming, people. Stop playing with these babies and reading. And I hope that's going to, as it move up, let me open up the rest. But yeah, these babies need to know how to read. And here's the deal. If Johnny cannot read and Johnny's IQ says that Johnny may never read, and notice I say never, may, because I'm not a psychic, and I know that God is powerful. But we've got to be able to say, Johnny can't read. Johnny's IQ is 60. Johnny may only stock at the local supermarket. And that's okay. That's okay. Just listen to what I do. When people say my kid's going to be a doctor, listen to all that it entails to be a doctor. It can be exhausting, which is why I want y'all to understand that when I see y'all at the Walmart, I'm not diagnosing you because it is too exhausting. Now, I may notice some things, but I keep it moving. I'm trying to find Kool-Aid jammers for these kids I told y'all about. They like these Kool-Aid jammers. And so if your kid is not able to bring a whole lot of information together, process it, and spit something out, it's going to be hard for them to do this. It's going to be hard for them to go to school. It's not impossible because I'm not God. But I just want you to know what it is that you're working with and be okay with that. Anything else in social? I want to know about legal history because my adolescents have legal histories. I don't care if you're on probation, but just tell me. Because one day if my schedule says call him at the, jail, I need to not be shocked by that, okay? I think anything else, that's Franklin. He's coming back. All right. Mental status exam. That's where I'm going to talk about everything from what you look like. So just to go through the mental status exam real quick. Mine talks about what were you wearing? How did you walk? What was your mood? What was your affect? So your mood is what you say you're feeling. I'm good. Your affect is either congruent, meaning that you look good, or incongruent, which means she looks sad. Something ain't right. There's a disconnect. I want to know about your thought content. Are you having hallucinations? Are you suicidal? Are you having delusions? Delusions are fixed untrue beliefs. having a delusion that someone is poisoning you. And it's fixed and firm, very difficult to treat. Hallucination is seeing or hearing things or feeling things or smelling things that really aren't there. So you can have auditory, hearing, visual hallucinations, seeing, tactile hallucinations, touch, and then you can have gustatory, gustatory, gustatory hallucinations for you smelling things that aren't there. Your attitude, are you cooperative or uncooperative? Your eye contact, that's important for autism because remember, they look at you if you have good eye contact, like I'm looking at you, but then gaze aversion is they'll look, and then as soon as they see you looking at them, they'll look away, or no eye contact. They just kind of look down and they have a whole conversation with you like that. I want to know about your intelligence. What do I estimate about intelligence? That is going to require a psychological evaluation. Some people I can tell by the way they put sentences together, by the way that they follow my instructions, by the way that they engage with me, that their intellect or IQ may not be in the typical range, but that is definitely something we're going to get psychological testing for. So don't be offended if I, request that. It's just me trying to make sure that we have adequate diagnoses. Your memory, your thought process, your dress, your language. Are you oriented? Are you oriented to person, place, time, situation? I know who I am. And this is something that I exercise a lot when I work on the geriatric inpatient unit, because sometimes they'll be oriented to person. They may know their name, but they know nothing else, okay? They don't know where they are. They don't know their birthday or anything else. And so that is important for that. Attention and concentration. Are they focusing or are they playing? I want to know about their activity. Are they just sitting there and still and standing like this, which we can see sometimes in patients with thought disorders like schizophrenia and bipolar, or are they hyperactive and moving all about and flipping, which could be a symptom of ADHD? Are they alert? Are there any dangers like suicidal thoughts? Do they have good judgment and do they have insight? Insight says, yes, I'm sick. Judgment says, yes, I'm going to get some help for it. Okay. Then I want to know about labs. Labs for me, if I have a concern that your kid is doing drugs, that's a lab. If I send off Vanderbilts, I want to look at those back from the teachers and from the parents and from anybody else who's around the child. That's a lab in my world. Lead can cause kids to have problems and look like they have ADHD. So I may request that. That is not typical. And honestly, remember, if you hang out with me all the time, you know that anything after 1978, 79 would not have lead in the paint. They took it out of the gas. But if you're living in an older home and you have a child who mouths, that may be something that's an issue. Then we're going to come down to the assessment. The assessment is where I use my DSM-5, my Diagnostic and Statistical Manual, which is our book that we make all our diagnoses by, and I pretty much know it, okay? Which is why I can rattle off these symptoms for you, because those are all diagnostic criteria that I go by. I'm not just back here saying, oh, you depressed? Oh, okay, let me give you a major depressive. Nope, you got to be depressed for 2 weeks, and you have to have either irritability or depression plus 4 other symptoms, and then I can say that you have a major depressive disorder, okay? And so I'm going to talk about that there. And then I'm going to talk about what my plan may be. And I usually give a pretty detailed plan. I do a summary. This is a 5-year-old with hyperactivity, impulsivity, and defiance. Mom and dad are not ready to start medications. They will follow up when they are ready. All right. And then I always talk about if we started medicines, what those side effects are. That's very important so that parents know. I try to not have my parents going to Dr. Google because anything you're looking for, you can find it there. And so if you're looking for children who jumped off buildings after taking a stimulant, I'm sure that there's an article or two out there, and you will be scared of giving your child that medication. I may also make other recommendations. Like I said, the child whose dad had the heart condition and died at 35, I had her to get an EKG, especially when we figured out what the dad had. I know how that runs in families. I know that anytime I see a teenager that goes up for a layup on the basketball court and when he comes down, he falls dead. And so I needed an EKG because I know that, because y'all know I'm a board certified pediatrician as well. And so I know that, and I will get that piece done. I may also refer you back to your primary doctor, because once a child who was like 8 or 9 years old, the mom was telling me about in the history that the child had an undescended testicle. So my next question was, when was it brought down? The mom said never. I immediately sent her back to her primary doctor so that she could say, my psychiatrist told me to ask about the kid's undescended testicle being brought down. And by the way, we want the testicle down so that it can be evaluated for testicular cancer, because there is an increased risk of that in children who have undescended testes. So she went and she told the doctor. He looks in the notes and he goes, oh yeah, I did mention that when he was a child. The kid was in the OR in 2 days, okay? So everything I'm asking is important. Outside of me doing my job, it really doesn't matter to me. But when you're in that room, you're my patient, and I'm going to do my best to hold up the Hippocratic oath of doing no harm. It may seem harmful to you because I'm all up in your business, but that's just me trying to get your kid covered. And if you don't tell me, I don't know, because remember, I'm a psychiatrist, not a psychic. So if you don't tell me, I won't know. If your kid doesn't like the medicine, I won't know, okay? If you don't like it, I won't know. If you don't show back up, but your kid's having problems, I won't know. And let me just tell y'all one other thing. One part of my job is helping parents with family planning. And I don't mean in the sense of don't have any more babies. I mean in the sense of your child has an IQ of 50. What are your expectations for that child, and what's going to happen to that child when you die? Parents don't want to talk about that. But parents, we have an obligation to make sure that our children who are not likely to be able to live independently, take care of themselves, grow old, and take care of us, as things kind of tend to do, we need to make sure that we have verbalized to someone, will you take my kids in the event that something happens to me? And my husband and I talk about that, and we're young, but our babies are young. And at this point, somebody's going to have to take them if something happens to us at the same time, which is likely to happen because we're in the car together all the time, all right? So that is a very tough conversation that always results in tears, because most times parents have not thought about it. Deep down in their heart, even though they've never said it to anybody, they know that that child is not likely to live independently. But it's just something that they cannot bring themselves to think about. But let me tell you this. You need to think about it. And one mama just said, well, I got several siblings. They say they're going to help. Let me tell you about help. Help disappears. Somebody needs to be the one that knows that it's going to be on them. And if the other of your siblings help them, that's great. But really, it's on them. So make sure that somebody knows. I don't care how healthy you are. For all of your children, but especially those children with any special need. We got to first recognize that they have it, and then we've got to make plans to get them situated. May be able to still work, and there are all sorts of programs that will put them in an apartment where people come and check on them. A group home may be something good for them. We as African Americans especially don't want to put our folks away. But if putting your old person or your young child away, as you say, is the best thing for them, then that's what you need to do. Sometimes my children with autism, and we talked about this in the autism presentation, sometimes they grow up to be very big, very strong, and very aggressive. And if you've got a newborn, but your 16-year-old who has autism is trying to throw them around like a football, we may have to think about that. And what I especially hate is when someone puts me in the position that now I have to report that. Because my job is to keep everybody in the house safe, especially my patient. So if my patient is the 6-year-old, but there's a 2-week-old, and the almost adult child with autism is having their way with everybody, I may need to bring that to some. So those are all. So that's why the family history is so important. That's why the family history is so important. I need to know about the 16-year-old who's 400 pounds and aggressive and who has autism. I need to know that. And I'm not judging you. I just need to know. All right, let's speak to some people. Okay, let me see if I can see Sands now. I want to see it. Oh, man, I can't see it. Stop playing with these babies, and they're reading. Why won't it let me see the rest? But she says preach. So whatever I said was good. Mama says when help is offered, please accept it for the child's. All I see is well, but I'm assuming well-being. And that's so very true. Hey, Auntie Denise. Auntie Denise is a retired educator. She knows as well. Sister-in-law Angie says, repeat what it's called when you look down and have a full C. When you look down and have a full C. Golly, y'all, I'm so sorry. Let me see if I can pull this up. Hold on. If y'all got a second, hold on. Let me see if I can pull it up. I'm sorry. Hold on, y'all. This is how we do it over here. We take care of people over here at okay, let's see. I'm gonna look on my computer. Golly, y'all, I'm so sorry. Okay, let me see. Where are my comments? Okay, well, if I can't find it now. Oh, wait a minute. Hold on, y'all. Because that was a good question, it seems. We like to get everybody's questions over here answered at Dr. Brandy B by any means necessary. And so, if y'all give me a few seconds. Oh, my goodness. It's 10:08, y'all. How y'all was supposed to tell me to stop. Why y'all didn't do that? Okay. That's a first-class doctor that reviews everything. Let me get into these comments. I'm almost done, y'all. I promise. But I want y'all... I want to know... I can't see them for some reason. But I'll come back and go through the comments, y'all. I apologize for that. Let's see. Mary Ann Gunter Dollar says, if your thyroid levels are off, can it cause major depression? So we have a term for that, and it's called depression due to a medical condition. Right, so we do take into account, and we also have a mood disorder or depression that's caused by substance use, right? And that could be a substance that I prescribe, like Prozac can sometimes switch people over into mania, or it could be caused by just having thyroid problems. Yes, so it can happen. Conversation. That's funny that y'all two commented. I guess we need to have a conversation. Stacy LB, thanks for watching. Repeat what it's called when you look down and have a full conversation. Oh, that's just called no eye contact. No eye contact. A child's well-being. Okay, it's coming, people. Stop playing with these babies and reading. My child struggles with reading, and I stay on him. I'm not embarrassed to ask for help, and I'm a teacher. Get the babies the help they need. Get the babies the help they need. And that is so very true, y'all. We can't do nothing quick over here. I'm sorry, y'all. Let me get back to where we were, and I'm sorry, I took all y'all's time this morning, but I think that's all we have over here at Focus on It Friday bonus Saturday edition. Was this helpful, y'all? Was this good? Y'all let me know if this was good. Y'all know I need some feedback. Now, I would never underestimate the preacher when he says, one of my former preachers used to say amen flower, because I guess we weren't talking, and now I know what the poor man felt like. Y'all are so kind. I just love y'all. Y'all are up here with me 24 strong. That's about as many as we have on a Friday at noon. Plus we had some new folks, so thank you. So remember, make sure you get all your stuff in order, but then I want you to be prepared for the actual day. I want you to recognize that you're going to be asked some questions about identifying information. You're going to have to give a chief complaint, which means why you came, and not because they told me to, or not because somebody scheduled me an appointment. Maybe if that's what they tell me about you, she told me to come. We want to know about your history of presenting illness, which means what's going on. Tell me more. And I'm going to lead that discussion, but this is your time to talk, because when it gets down to the diagnosis, I'm going to be talking then. All right. I don't want you to be telling me a whole lot of stuff then, unless you really think it's pertinent. But that is my time to talk. The most of the beginning and the most important part of the interview is what you're telling me. All right. So be honest, be succinct, get to the point, but tell me everything I need to know. And I know that's a lot. Like, well, how I'm going to tell you everything, and I don't know what you need to know. If you think it's important, tell me. But don't tell me all them extra sentences, because I got other patients. You're the most important one when you're there, but you're not the only one. You get the difference? All right. That's your HPI. And then we want to know about your review of systems. Is anything going on? Did we just have coronavirus? Somebody in the house, or, did you just have it? I need to know about that. Because that could be impacting your mood. We don't know what all it impacts, but we know that being in the coronavirus pandemic in general means that some things are going on. We can't get out and about, teenagers. And if y'all have a second, stop by. I think I'm going to try to share it, but check out the Jack and Jill teens of Tuscaloosa. I'm going to be on at 4 o'clock talking about some other serious things. You ought to come over and listen. Hopefully I'll be able to share it over here at Dr. Brandy B. But I'll just kind of have to see. But look out for that. I did make a post about it in Dr. Brandy B this morning before I made the post inviting you here. So that's your HPI, that's your review of systems, your past psych history. We want to know about any medication trials, and ADHD is a mental illness. I can't tell you how many times I'll be like, has your child been on any medication for a mental illness? I want you to get used to saying that ADHD is a mental illness. It's in my book. That's how we diagnose it. If it weren't a mental illness, think about it. Nobody would have a problem with their child. Even we treat insulin, insulin dependent diabetes every day. Nobody's trying to secretly do that. We asking the church to pray for us. But we don't want the church to know that kid has ADHD, but the church knows, okay? Let me get back on track. Past medical history, past psych history, family history, okay? All those people that never finished high school, all those people that always ended up in jail, all those people that got on drugs, we want to know about that. And then your social history. Who do you live with? Your schooling, and then what happens outside of school and home, like have you been to jail? Do you have any legal problems? Don't let me look on your ankle and figure out that piece of jewelry did not come from a jewelry store. Just go on and tell me what happened, because I'm going to ask. I need to know about DHR, not because I'm judging you, but because that tells me a lot about this child's past exposure. And then I want to know about DHR, legal, and drug history in the child. Yes, in the child. And we're going to talk about that soon. But anybody 8 and for sure 11 and up, I'm asking about drugs, so don't get offended. Let me tell you something else I'm also going to ask about in the HPI. I'm going to ask your child of a certain age, are they attracted to boys, girls, or both? I don't want you to get upset with me. This is an important question because I need to know, then have you come out? Do other people know? Are other people in your home supportive? Because this could all not have anything to do with your knee that got replaced, as I talked about earlier. It could have something to do with the fact that your knee got busted out when you were running from your daddy, who told you that you weren't going to be no blankety blank in his house. And I need to know about that, right? I need to know about who's supporting you. Children, when they are around the time of coming out, they get depressed. They are at great risk for suicide. I need to know about that. So don't get offended. I don't really care about your child and their sexual activities. You need to talk to them about that. That's not my job. But I'm going to ask about it for the reasons that I just explained. All right. And then after the social piece, I'm going to start looking at any labs, reviewing them with Miss So-and-so and Mr. So-and-so who sent over Vanderbilt's. And then after that, we are going to talk about diagnoses. Most times I'm dead on, and that is most times, and parents agree. Why do they agree? Because I explain it to them. I don't put a whole lot of what I feel and what I thought. I tell them what the criteria are, and I tell them how their child met those criteria. Also, everybody thinks their child has bipolar. I explain to them why their child does not have bipolar. I don't just say, your child ain't got it. I explain that to them. So it's important that you have somebody who is explaining all that to you. And then what I always say to families is, these are some options. What would you like to do? Because the way that I practice is like a driver's ed sort of situation where I understand, I never took driver's ed, but I understand that there's a wheel and a brake over there for the teacher. And so, if at any point the car starts going in the, awry, in the wrong direction, too fast, whatever, that person can turn the wheel or can brake from over there. That's my job. I'm the teacher, but it's your job as the parent to decide what you want to do. And sometimes that may be nothing. Sometimes I have more energy than others because remember, this is very exhausting. And so I will say, oh my God, this baby is struggling. And I can tell you how many grown men I have sitting in my office when they have it explained to them what is wrong with their child. And they break down in tears because they've been beating that kid every day for the last 5 years. And they're finally in 6th grade and somebody gets it and they believe it. And they come back a month later. The mom and the daddy going on dates again because they like each other again because they're not fighting over with the kid. I mean, so rewarding, but best the kids are getting the treatment that they have. And then we set up a plan to come back. If you're not on medicine, no, you're not coming back to see me. There is somebody else that wants that spot, and whoever is doing my scheduling, they want to give it to them because guess what? They are wearing them out about, has anybody canceled? So you're not coming back. We can do some other sorts of consultation, but I cannot give you another spot. And I hate to sound like that, but really, you know what you want, and you know when you're ready for it, and it's not my job to convince you of that. All right? Any other questions? Let's speak to some people. Let's see what else we got going on over here. Conversation. Alicia says, great, thumbs up. Priscilla loves it. Love it. Miss Frida, very helpful. Nikki McCann, yes, very helpful. Thank you, says Miss Sadie. I will teach you how to show comments during the live. It will display like a ticker. Very good, because what I'm trying to do now is press this more, and it ain't working, girl. It ain't working. Great job, says Miss Lovey. Yes, love it, says Sis Angie. You were wonderful, says Miss Patrice. Very good job, Brandy B. says saying, my mother believed in the public library. We had to read books all summer. And your mother, who's my grandmother, had me reading all summer too. Please let your children and grandchildren read and buy books. That's right. While y'all buying all this stuff for Christmas, make sure you get them a book and that you read it. Mama Diane says always good information. Maybeth Nick says traumas. Question mark. Traumas, Maybeth, yes. I ask about traumas. Has your kid had any sexual, physical, verbal, or emotional traumas? They're all traumas. And guess what the most common trauma is? The most common trauma is emotional, right? And that is for adults and kids. That is for your spouse and your best friend. That can even be for your mama. Your mama can be what people call now toxic. So watch out for that. Miss Rosalind Williams is watching. Thank you. And Kayla, my classmate, is watching. Deborah Lafayette is watching. Thank y'all so much. I held y'all over, and y'all did not do what I asked y'all to do. I said, right, too long. Stop over your time. And look, here we are. But, I mean, y'all still here, so I guess y'all like it. All right, some announcements, because like at church, y'all know I go to the black church. Vote. Get your mammograms. Starting Monday at 5:50, we're going to do, because, right, remember from yesterday, my 5th anniversary in private practice is the 16th. My birthday is the 17th. And we're going to do Dr. Brandy B's 5-star tips. Hey, Stacy, 5-star tips. We're going to do it at 5:50. Now, Priscilla, set your clock and act like it's going to start at 5:30. So you can make it at 5:50 every morning. No worries if you're not up. Just catch it later on in the day. Somebody said, wow. They sent the emoji, wow. 5:50. It's going to be real quick because I work out at 6. All right. But we're going to do that. We're going to be celebrating. And then next Friday, Mama said she had hers yesterday. That's right. Get your mammograms. And Mama voted yesterday. I made sure I took her to vote. So take your elderly people to vote who can't get out and about on their own. But Mama says she's not elderly, but I took her to vote because she don't like to drive. So that's what we're doing. I've got a whole lot of different things coming up. Friday, I'm going to try to see about having us a special way to have our interaction. But we're going to have some fun on Friday. I don't focus on it Friday, but we're going to meet Monday, Tuesday, Wednesday, Thursday, and Friday at 5:50 a.m. for some 5-star tips. All right. If there are no other questions, Frida says, awesome. Love you, sis Frida. Happy Saturday from Stacy. Watch out now, says Mama. Angie's laughing. All right. If there is nothing else, then I'm going to go. I want y'all. Listen, y'all. Listen. Okay. When we started this Focus on It Friday bonus Saturday edition, y'all know what it was doing over here? It was raining. And what did I tell y'all about Focus on It Friday and the sun shining? Hallelujah, the sun. Well, it ain't no sun, but it ain't raining. It's not raining. It's not raining, y'all. We have fun over here. We are putting the rainy days away on Focus on It Friday. Whether Saturday, Sunday, Monday, Tuesday, Wednesday, Thursday, or Friday. I love y'all. I'm gonna get out of here. We got a busy day. Lord of mercy. I got a birthday party for my auntie, 85 years old today. Auntie Mary Joyce, happy birthday. And I've got a speaking engagement at 4. It's gonna be on Facebook. If you can catch it, I hope you can. Rest up, go to church tomorrow. Hey, Auntie Wanda, thanks for coming on in. Take care of y'all selves, y'all. I love y'all, and I love having y'all with me on Focus on the Friday. Share this video. Hey, one other thing, y'all. This is it. I promise. 1330-ish is about where I am now. Do me a birthday favor. Help me get up to 1,500 followers by my birthday on Saturday. All right. 1,500. Y'all, that's 200 people. There are 20 of us here right now, but several have come and gone. 600 people are viewing my videos at the least, and up to almost 2,000 at the most. If everybody on here would just go down your list and invite everybody you know, let's help Dr. Brandy get up to 1,500 followers by next Saturday the 17th, my birthday. That'll be a wonderful birthday to give to me, and it'll be free. All right, let me get out of here. I love y'all. I am Dr. Brandy B, your triple boarded child and adolescent psychiatrist. Through my Facebook Lives, whether Friday or Saturday or Sunday or Monday or any other day of the week, my presentations, and just seeing these babies and trying to help them get better. I help worried, overworked, overwhelmed moms get the education that they need so that they can help these babies get better and be successful in the classroom and in life. Have a good day, y'all. Be safe. The Delta is coming. All right. Love y'all. Bye-bye.